All right. Hello, everyone. The usual cast of characters have changed a little bit. Usually we have Courtney and Liz from Commonwealth. Today you got me. So hopefully this does better than I expect it will. So welcome to Interoperability Unlocked, where we can share insights from the intersection of trust and community and things health data. Today we're thrilled to welcome Marilee Benson, president and co-founder of Zen Healthcare IT, to unpack delegation of authority, what it is, why it matters, and how it impacts trust across frameworks like care quality and TEFCA. Marilee, can you share more about Zen Healthcare IT, what your role is there, and how you play in the interoperability ecosystem?
Yeah, I'd love to. And first of all, thanks so much for inviting me. This is fun. We are a interoperability enabler. So we take our purpose-built platform that was designed from the ground up to do healthcare interoperability and data exchange really, really well, and combine it with our super smart interoperability subject matter experts, put those together and just simplify all things healthcare interoperability for our clients. And we really think both of those things are important. There's certainly other people out there that have platforms. I think what makes us unique is that access to the subject matter experts to help people navigate all the different options, all the different use cases, and make sure that at the end of the day, it just really works for them.
Oh, I appreciate that. I also appreciate, thank you for being a member of Commonwealth. We don't only have people that are members on the show, but when we get them, we have to at least say thank you. You're a recent addition, and I'm glad you saw the way. That we're thrilled to have you here, and we love the use cases and the broad aspect you take to interoperability. So thank you for all you do. So I have a couple questions. There's some that we wrote up, and some that may just pop in, and you'll do your best. So tell us a little bit about delegation of authority. Kind of why does this thing matter? To you and to the interoperability community, and does it unlock anything new in terms of your business and what goes on in our world?
Well, it's always interesting to talk about the definition of delegate of authority. So I think sometimes it's good to ground it in what maybe some folks may be familiar with. So under care equality, we had this use case called on the behalf of, and then under TEFCA, they kind of took that on the behalf of use case and the experience we had under the care equality network, what was going right, what wasn't going quite as right, and improved upon it with their delegation of authority policy. And then care equality has since aligned with TEFCA around that, I think, enhanced business process and definitions that delegation of authority brought to the table. And so that's important. I think that in terms of why it matters, for our customers, we do a lot of work with health tech vendors. And so those health tech vendors are often sitting next to big EMR systems, whether it's Epic or Athena Health or ECW. And so those provider groups, which are called principals in the delegation of authority world, they're using a core EMR, they're on the network, but they're bringing in this innovative technology that solves a special problem for them, that's optimizing the provider experience and reviewing a medical record, or optimizing a patient outcome, because it's these systems like, you can think of all the AI tools that are coming out right now. So this ability to coexist with the core EMR and leverage the access to the full medical history of the patient through the national networks makes it much better for the principal who has this diverse ecosystem of different healthcare systems. It's taken integration from being a one-to-one. Every tech vendor has to connect to every one of their customers, which is really hard to scale. And at least for the use cases that apply to national exchange, care equality, TEFCA, it has made that process much easier. So I think everyone wins. And I think the other side of it, so I think we're unlocking innovation. That's very important. And then the other piece of it with this enhanced business process with delegation of authority, we're unlocking trust, right? Because when you have this rich ecosystem and complex environment, it's easy for maybe certain use cases to not exactly be following the rules of the road of exchange. And so this business process ensures that all the stakeholders are really informed in what's going on, and all agree that the use case is meeting the requirements of the network.
Yeah, you mentioned you talked about a process. Describe a little bit about what you got to do to make this stuff work. I mean, I've heard that it's not as fun as you want it to be, but sometimes process is important. You mentioned trust. I was just as an aside, I was asked to provide a comment on like what's the greatest barrier to interoperability right now, and quote whatever. My first answer was fear. Right? We still are afraid of moving forward on a couple things. And I think we have a pretty good process here, but it's not always easy. Could you tell us a little bit about that?
Yeah, I totally agree. The process is important, but the process is proving to be a little difficult to navigate. I think the reason it's hard right now is it's just new. So we're in an education phase. We're needing to teach people what the core terminology is, what's a principal, what's a principal's implementer, what's a delegate, who's the delegate's implementer, who are all these parties, what roles do they play, number one. And then I think the other thing that's a little confusing is that we're in an implementation phase. Right? It started in May with some new requirements, and it's not really done until the middle part of September. Well, that means it's literally changing while we're moving forward. And that I think is creating some confusion for folks. But right now, the biggest challenge is, because it's new, is just educating all these stakeholders on what the process is. I literally just had an email today that one of my customers was navigating this with an EMR. And they were trying to answer a question from the EMR vendor, and they answered it incorrectly. And even though we've done education, it's just, I think the fact that they weren't quite 100% following the process is just due that there are multiple steps, and we just have to keep iterating and practicing, right? And so luckily, I'm able to kind of jump in and help kind of, oh, no, that's not exactly right. Here's the steps, because what I'm finding, and I'm curious if Commonweal is finding this too, I'm not only educating our customers who are often the delegates, I'm also educating either the EMR, if they're an implementer, or the EMR and the EMR's implementer, because they're not always implementers, right? They may be, for example, Athena Health, maybe Commonweal as their implementer. So it's a lot of education happening. But I do think once we're fully through the implementation process and people have exercised this process a number of times, it will start becoming much easier.
Yeah, I think that's a good insight. A lot of times we look at things and that we're bothered by, and it's like, is this a permanent condition? Is a thing we forget to ask ourselves, right? It's like traffic. You're still going to get to where you're going to go. It's just going to not be so great for the next half hour, and maybe someone should get their accident cleared and get to the hospital they need to get to, or whatever it is, and then we can move on and drive along the turnpike. But it's a process, and you just got to go through it. So I appreciate that, and I think the trust is very important. So I fully with you there. So have you seen any best practices? When it comes to getting delegation authority across organizations, or now you do mostly health tech providers, so it's not like an ACO or a true third-party downstream way far that no one can see what's going on.
Yeah, you're right. We haven't run into that multiple levels yet. I know Commonweal, I think, is probably maybe having a little bit more experience with that. But it's interesting. I don't know if people know, but in TEFCA, they kind of envisioned a world where there was no limits on the number of downstream delegates. I think of it as a chain of custody, right? Who are the stakeholders involved in each one of the steps? So you get to the actual final delegate in that first tier, second tier, third tier. Care Quality took a more conservative approach, because I think we very practically looked at use cases and said, can we envision a use case today where we have more than a first tier delegate, so a delegate and then another entity below that? And we just couldn't come up with any immediately. And so we said, let's start with the delegate and then this concept of a first tier delegate, because we did think in an ACO world that first tier might be needed, but then let real world use cases give us feedback. And I think that feedback is going to be really important. In terms of the best practices for us right now, one, I think we're working with a smaller set of implementers, and certainly Commonweal and Liz has contributed a lot in this area of let's fine tune the business processes better. So for example, right now, we don't even necessarily know for every implementer, well, where do we send the delegation notice? And so I think one of the things we're trying to do together as a community is further outline those best practices. So we're not each inventing our own, but we're coming to that together collaboratively, and consolidating information. We've asked Carrie Quality to help us. And I think that they have made a commitment, and that was messaged yesterday on our Carrie Quality Advisory Council meeting, actually, that they are recognizing that Carrie Quality and the advisory council, the steering committee, work groups need to continue working on the operationalization of this process to make it easier for everyone.
Yeah, it's we've experienced some of the things you've talked about. In particular, what we found that was kind of surprising, actually. It was a weird thing. So you know how the directory works, that the implementers put in their entries. So we're an implementer, you were as well, and you can still do that, but you're doing a lot of stuff through our connection now, which, thank you again.
Yeah.
But sometimes implementers use other implementers. So they've signed on to the terms and conditions, they've signed on to Carrie Quality, they pay their fee, they're a member implementer, but then they use someone else's gateway to do some of the work. And
we are an example of that.
Yeah. And so then you go to the implementer of the entry and say, we've got this form from the principal, go light this thing up. And they're like, well, we're not the implementer. There's an EHR that's the implementer. We go, yeah, but you control the directory entry. So it's your DOA, your delegation of authority notice that needs to go in there. It's your job. And they're like, no, we need to get permission from them. Oh, no, you need to get permission from them. That's fine. And you can cover all that. But the clock started with you. It's
Yes.
not, it's actually your obligation because they can't control the directory anymore so we've created this nesting doll challenge. And it does take some extra time to get through stuff. And it's not like people are mad or finger pointing. It's just, it gets a little confusing. And so we're learning.
That's a great call out. And we are in some situations, we're acting as the implementer, and we have folks, underneath us as children, if you will. And then they have children, right? Again, that chain of custody. And then we also just act as a gateway. So we have customers, to your point, they've signed the Carrie Quality agreement, and we're just a piece of technology. But I will say again, that taking that concept of platform plus expertise, we take the expertise on that really seriously. So we are trying to really educate our implementers that are using our gateway that this is their responsibility, but we have their backs, right? So we will help advise them. And if they have any questions, they know to come to us. And because I'm running into the same thing, we're kind of seeing it from the other side, where you get to an EMR and then the EMR doesn't necessarily know what's going on. And some of that is because there's a lot of change happening. EMRs are, even looking at Athena Health, Athena was their own implementer. Now they're 100% rolled underneath Commonwealth, which I'm super happy about, because Commonwealth knows, you guys know exactly how the process is supposed to work. So that helps immensely. But in the beginning, there was some confusion as to, with Athena Health, where does those delegation notices go? We fixed that one. And now we're kind of ticking off every EMR. I feel like every week I'm educating or learning the process for a new EMR as we go through this.
Yeah, I think we're all looking forward to the next iteration, but we're getting better at operating the current one, which, maybe that means we don't need a new iteration. Like sometimes don't change it if it's not broken. Just, it was just a learning curve. So let's talk a little bit about, who should be using delegation, right? It's not just about who can do something, but it's also about who should do something. And have you, in this process and trying to educate, it seems like that seems a large part of what you're going through right now. Is there any way you can think of, like, how healthcare leaders can create roles and paths to help the process and help them understand delegation, how to bring their fancy new shiny objects onto the networks?
Yeah, I think that it's the first conversation we have with health tech vendors. And a lot of health tech vendors come to us not really even knowing what TEFCA or Carrie Quality or Commonwealth is. And so when we're talking about all the different possible ways that they can interact with EMRs to make their solution effective for their provider organizations, we have to educate them that this is even an option. And I think the other interesting kind of who can gain value is this whole conversation around, are you initiating only, or are you, is there reciprocity? Because I think that there are health tech vendors that are sitting next to EMRs that they are enhancing the data in some way. And so one of the evolutions that has taken place between on the behalf of and delegation of authority is we don't assume that this health tech solution that's sitting in an ecosystem is just initiating. If there's valuable data there, that needs to be shared back. So again, that's part of the conversation. And one thing I didn't mention earlier, but I think is super important, and maybe you guys are experiencing this too. It is not nearly as difficult to navigate when our health tech vendor is selling to a smaller provider group. But when they're selling into like a Sutter Health or a Dignity Health or a big health system, this delegation of authority use case can get really interesting because you have so many important stakeholders in the health system, right? So the purchase of this tool, or maybe an ACO is bringing a tool into a specific part of the health system, that conversation gets a lot more complicated quickly, because it isn't enough, if you're sending a delegation notice in, I said at the beginning, you have to have the right signatures on the delegation notice. And that's a core piece, right? So that if you look at that delegation notice, there's some really important things that the principal is validating. Is it really treatment? Because that's really, it could be used for other use cases, but that's a big one right now. Is it initiating or responding? In other words, is there a reciprocity requirement? So these are conversations that need to happen at the health system level across multiple stakeholders in that organization. So I think for my message to health tech vendors selling their solutions into that space and seeing this wonderful opportunity to innovate and scale and grow faster, you've got to do your homework in terms of communicating with all the stakeholders in the health system early. You don't want to wait until you're trying to onboard your new customer that you just signed, that you haven't had that conversation.
Yeah, it's funny. Yeah, very, very true. And I get confused sometimes of what a record is these days, right? Because you think of what is a record, we think of the EHR and that's a record, but there's other stuff. Like when you show up as a patient and say, I want all my data, which you have the right to go to any of your providers and say that, it's getting harder for them to figure out what data is. How raw are you supposed to get? Am I supposed to get the ones and zeros from the EKG, or the printout, or the interpretation? Right? What's the data? And that reciprocity thing, the novel data, the new data this thing produces, sometimes isn't data the way we think of a record. It's actually a measurement that is then recorded in the EHR. Like you don't get to hear what the doctor heard in the stethoscope. They just write down no murmur. Right. That's the answer. And that's the data at the end of the day, even though you use this tool. So how different is a digital health tool doing a similar thing where it's giving clinical decision support and you're taking that result and saying in the record, in the EHR, what it is? Does that application now have to share back that result? I don't think so, because it's already there, but it may be more robust. So I think we're actually hitting this line of what is the lowest level of data that we should be considering the record? And I don't think we have an answer. I'm not sure if you have an insight on that. Like I keep getting confused.
I think you're absolutely right. I think that's one of the next problems that we're going to be looking to resolve is this question of, especially for delegation of authority, when do we really need to respond with data? And I think that conversation is going to kind of start in the health systems themselves, particularly the larger ones that care more about the details. Is in my experience, they care more about those details. They have more governance, in place and those kind of things. And I think you draw a good point. We try to. It's important for those companies, those enablers like Zen, implementers, who are working with health tech vendors to really have a deep conversation about the data, the novel data, or the contribution. What's the value proposition? What is getting back to the EMR, and what maybe isn't, that does offer real value to at least some providers? I would say, a good example might be systems that identify care gaps. those care gaps may just not have a good place to live in the EMR that's digestible. But if you had a report that said, here are, the 3 care gaps that we have, well, that's pretty powerful information for a new specialist who just, had the patient show up, or a new primary care physician who's working with the patient. So I'm actually pretty excited about those conversations. I hope that one of the concerns I have is that we get too restrictive in what's valuable data, right? It's like if we use the bar of an EMR, a full designated record set, I think we're missing the value of this incremental small bits of data that are giving that one little piece of the puzzle for that patient that may really be vitally important. And it isn't buried within this huge designated record set.
Yeah, that's an interesting point. I'll be honest. I actually have concerns on the opposite side too. Like I assume you've seen like ultrasounds that are being used, handheld ultrasounds being used instead of stethoscopes to do heart rate and just general murmur detection, things like that. That's a lot of data. That's a full Doppler is going on there. It's a small device, but normally with a stethoscope, we would just say beats per minute and a result on whether it's a good EKG wave, and that's it. Should we have stored the whole raw data set? Should be accessible to the next radiologist and the next cardiologist and the next general physician to see a history. It's like, we would love to have some more stuff to compare. We also have to be aware that we just can't store everything. And then we put it on interoperability, we wind up restoring it in many places. It's a lot of storage. Only so many warehouses we can set up. So
we worked on the imaging pilot that Carey Quality did. So I'm with you. And we were not advocates of the model that they first piloted, which was moving the image itself, because we know better than anybody how huge those DICOM images are. And that, really, if you look at how other imaging interoperability works outside of the networks, it's more sharing a link to the image. And then, you can retrieve it from the source system if you want, but you're not trying to always move that big file. And I do think it's one of the reasons why we haven't been terribly successful at imaging exchange, because of some of the inefficiencies you mentioned. And yet we also know, and I know you were on those Carey Quality meetings, that's what people want. So we got to figure that one out.
Yeah, awesome. All right, so let's go one last question. Do you have any common questions or any advice you would like to share with our attendees, the viewers at home or wherever they are? Hopefully you're not driving and watching this, people.
Right. Well, I think the common things that I try to convey about delegation of authority is just making sure that people understand, the terminology, right? Do you know what a principal is? Do you know what a delegate is? Do you know who the associated implementers are? And if we can get to that very quickly, I think it does make the process move much faster.
Awesome. Okay, we always have these kind of rapid fire things at the end. I was on the other side of this once when I got to join. So as we look at the current health data exchange landscape, 1 or 2 things you're excited about in the future?
New exchange purposes. Individual access services, yay. And we're working with you guys with several new clients we're onboarding for that. But then all the others, right? The 3 new operations use cases for TEFCA that are coming up at the first of the year. TEFCA has a nice long list of them. I think the other one that you guys mentioned recently is choose your own trading partner. So many use cases for that. I think that one in particular is going to unlock a lot of innovative use cases that have been blocked previously.
Well, that kind of leads to the next question. So looking at delegation authority, what does it unlock that we weren't able to unlock before?
I think trust and transparency, to go along with the innovation that it drives. But I think layering in the trust and transparency is critical so that we can continue doing the innovation.
Oh, awesome. Well, I appreciate that we've taken a lot of your time here already. So let's help you have at least a little plug. Where should people go to find more information about Zen?
So you can go to zenhealthcareit.com. visit our website. And we even do something kind of cool called a free 15 with an interoperability expert. We want to just cut to the chase and get the real experts on the phone with people that have questions they need answered.
There are a lot of questions out there. Well, I really appreciate your time and everything you do to help move the ball in interoperability in healthcare, a wealth of information and a wealth of skill set over there. So thank you very much. And thank you all for at home or wherever you are in office, listening or watching and both. And we'll see you soon.
Thanks so much for this opportunity. You guys are wonderful partners. Thank you.
Thank you.